This presentation will show how Central Maine Medical Center conducted a risk assessment in 2010, realized the need to encrypt data at rest, and implemented encryption. I'd like to welcome our speakers who will provide us with more information on this topic. Denis Tanguay is the Chief Information Officer for Central Maine Healthcare. Prior to accepting this position, Denis was the Director of Technical Services for Central Maine Healthcare and the Site Client Executive for CareTech Solutions. Tanguay's experience in healthcare information technology spans more than 25 years. He served as the Manager of Network Systems for Maine Medical Center. Tanguay has a bachelor's degree in computer systems from Daniel Webster College and is a member of HIMSS. Our other presenter, Jeff Bell, is Director of Information Security and Risk Services for CareTech Solutions. Jeff's experience in healthcare spans more than 25 years. He previously held IT management and leadership positions with the Detroit Medical Center and the Visiting Nurse Association of Southeast Michigan, where he was CIO and Security Officer. Jeff has the CISSP and CP HIMSS certifications. He's currently a member of the HIMSS Privacy and Security Committee and was previously the chair of the Risk Assessment Work Group of the HIMSS Privacy and Security Committee. Now please join me in extending a warm welcome to our speakers.
All right, thank you very much for joining us this morning. I know it's early for everyone. Before I get started, I'd like to get a little class participation here. Curious to know how many hospitals or organizations out there have encrypted. Could you raise your hand? So it looks like about half of you guys. That'll represent our numbers as we go through the information. So thank you for that. This slide cracks me up because we have no real or apparent conflicts. My wife might argue with that, so we'll keep going on that one. So learning objectives for this morning. Recognize the critical need for security risk assessment, identify risks to data at rest, and then we'll go through our project plan and take a look at that. That's me. So we'll go through, first thing, we'll go through the HIMSS value category slides to show what we think are the values of this presentation in encrypting. So in this particular one, trust is an integral part of your patient's expectation of your organization. If they don't trust that you're going to secure your data, then you're at risk. And as this one article represents, patient dissatisfaction with protection of information. Treatment, another value category. Patients may not disclose relevant or pertinent information if they don't trust that you'll protect their data. If they don't disclose a piece of information, you could put their care at risk. So we want to make sure that doesn't happen. Electronic information, as the need for sharing electronic information becomes more and more and increasing every day, we want to make sure that, again, the patients have trust in us and that we will protect their data. And then the last one, potential savings. The Poneman Institute estimates that an annual loss to an organization can be somewhere around $1.2 million. There's a pretty hefty fine for every record that you lose, and all you have to do is lose a laptop that's unencrypted, and the dollars can add up very quickly. I'll turn it over to Jeff Bell here for a little bit to talk to us about the need for risk assessment and evaluating risk to data at rest.
So in my previous job, I was working with a home health care company, and I first really began to think about these issues then. If you're familiar with home health care, it involves, in our case, about 150 nurses and other clinicians, physical therapists and such that would drive around throughout the Detroit metro area, the 5 counties surrounding Detroit, and provide healthcare services in patients' homes. And they're walking in and out of those homes all day with laptops. And, it was readily apparent that we would occasionally lose a laptop. I finally came to the conclusion I just had to assume that was going to happen in spite of all our best efforts. And in the early days, I started working there in 1997, we were primarily focused on protecting the assets themselves, the physical assets, the laptops themselves, and just not wanting to have to replace equipment. But as the HIPAA rule came out and we became more aware that the real value that they were carrying around was the information and the risks to patient privacy and patient security. We began to shift our focus from how to protect the equipment to how to protect the information that was there. And so in those early years, initial years, we had implemented many of the controls that I list here on the screen, but had not yet implemented encryption and tracking and wiping. Just looking back and thinking about some of the legislation and regulations that came along during that time, we're all familiar with most of these. If you don't live in Michigan, you might not know that the Michigan Identity Theft Protection Act was enacted in 2006. So the HIPAA rule had come out a few years before that, and I'd been thinking about that addressable requirement for encryption of data at rest. But then the Michigan law came out and made it crystal clear that personally identifiable information, if there was a breach of that information, was going to require notification. And again, the Michigan law put a safe harbor for encryption of data at rest. So really put that topmost in my mind. And so in 2006, I began encrypting laptops, and I'm just trying to make the point that it all starts with risk management, thinking about the basics of how do you manage the risk. Another thing that happened in my life there is that in 2006, shortly after that Michigan law came out, one of our major competitors down the street, a major health system, had a breach that was reported in the newspaper. A home care nurse lost her laptop. The reason she lost her laptop is she lost her car. Her car was stolen, and the laptop was in it. And the laptop was encrypted. So I'm sure at first they sounded real good until they asked that one question they probably wish they hadn't asked: was your password anywhere on that laptop? And it was. She had taped it to a sticky note. So never forget that sticky notes are a serious security vulnerability point. So they did the right thing, that organization, and notified everyone. 28,000 patients, though, on that laptop. And I was very thankful we were using a different application that only downloaded to the laptops the records that the nurses were working on at that time. So that's a good little point, too, to when you're thinking about risk assessing the purchase of an application, think about where it's storing information and how much it's storing, because all that data becomes at risk, especially if it's on the endpoint. Now, the HITECH Act in 2009 points out that there's a safe harbor. They don't use the word safe harbor, but we all refer to it that way, from breach notification based on two things: either encrypting the data or properly disposing of the data. Both of those have to be done properly. And I'm so glad that HIPAA requires a risk-based approach to security. We think of HIPAA as something we have to comply with. It's government regulations, yes. But it takes, HIPAA, I think really, if you read it right, it takes us out of just a checkbox mentality and really forces us to think hard about what we're doing and whether the decisions we're making are really having the effect of mitigating risk and making our patients' data more secure and our organizations at a lower risk posture. And, we read these two implementation specifications out of the security rule, the requirement to conduct a risk analysis and the requirement to do risk management. But I love the sentence that comes even before that in this section where they just talk about the guiding principles that apply to the whole HIPAA security rule. One of the sentences there is that we're required to protect against any reasonably anticipated threats or hazards to the confidentiality, integrity, and availability of EPHI. And so I think that's a nice way to frame our own approach to things. I like to think about things that way. Have I done the work in my own organization to reasonably anticipate the things that could happen? I go clear back to one of the early big, I don't know if it was a fine or a civil monetary penalty with UCA Health System. We're probably all remember that incident where they had, this was in 2011, and their employees had been snooping in the EMR, and celebrity records were coming to light. Celebrity healthcare activities were coming to light. And this is kind of what seemed to be the basis for that fine that, I don't know if it was CMS or the Office of Civil Rights at the time making that decision, but they said, these were activities that you could have reasonably anticipated would happen, and you had the data to detect that it was going on, and yet you weren't using that data to detect. And we can think about any of our security risks and security vulnerabilities in that same light. What could go wrong in our organization, and what have we done to protect against that? Here I just take a very high-level look at the risk assessment process. I'm not going to spend much time on this. There have been some full presentations on this topic that have really been quite good. But just to briefly outline the key steps. One, you can't protect what you don't know you have, so you have to identify your assets. And I always, when I'm doing a risk assessment, I go department by department and ask people, what systems do you use? Where do you store your data? What do you do with it? How does it move around? Because until you ask those questions, and I even like to look people in the eye and not just do it through a questionnaire if that's feasible in your organization, and have a discussion about it, because things will come to light. You will always find surprises on what's going on in your organization. It's not just about the technology, it's about people and process too. Identify the threats, identify the vulnerabilities. Of course, the way we break down threats and vulnerabilities, we're saying a threat or a threat source is something that could exploit or take advantage of a weakness, a vulnerability in your environment to cause harm to your organization through the confidentiality, integrity, and availability of information. And then you think about what is the likelihood that could occur in any given event, any given risk scenario, and what would be the impact to your organization if it occurs. And that gives you your risk level. Usually handled at a qualitative analysis, high, medium, low, or maybe you do a 5-point scale. But it can be done quantitatively, and we do take a little shot here. Denis already showed the slide where we do a simple quantitative analysis with respect to encryption. We'll come back to that slide in a minute. So that's your risk assessment at a high level. Risk management then is saying, well, what are you going to do with that information? And that's an executive level decision, right? Only the people that are governing the organization at the highest level can decide, do we accept this risk? Is it okay? Is it reasonable and appropriate level of risk? Or do we need to knock it down a notch? And that's what we call mitigation. So when I do a risk assessment, I'm always assuming that they might want to mitigate the risk, especially if it's a medium or high risk, and list steps that they could take to mitigate recommendations. You can also sometimes transfer risks. We're all starting to look, I hope, at cyber liability insurance is one way to transfer. Outsourcing can sometimes be a way to transfer some risks, though perhaps not as much as we might think. And then risk avoidance. Occasionally a person will just say, you know what, this business practice is too risky, the benefits aren't that great, we're just going to stop doing it. And sometimes that's the right thing to do. When we think about risk mitigation, we're talking about then implementing additional safeguards to reduce risk to acceptable levels. We've made a decision that the risk level is not acceptable. It's putting too much risk on our organization. We're going to do something to reduce it. And you might say, well, how do you know what the right steps are? And I just wanted to mention one place you can turn is to some of these security frameworks. I mean, hopefully you have someone in your organization who's well-trained in security and is familiar with common security controls and how effective they are and how to implement them. But, if you need some guidance, these are some good resources. The NIST 853 has recently been updated and is very comprehensive list of security controls, high trust common security framework, the ISO 27001 and 2 series. One that I like is the critical security controls, formerly called the 20 critical security controls that the SANS organization has had some influence in, along with a lot of other organizations, COBIT and COSO, and there's many others. Recently, just a couple of weeks ago, NIST finalized their cybersecurity framework. And so that's a new one. It came out in preliminary draft probably, 4 or 5 months ago. I just read the final draft on the plane. It is worth your attention. It's pretty high level, but it directs you back towards some of these other frameworks. But those can all help. Now, let's zero in on encryption. Encryption mitigates certain types of risks. And in particular, encryption of data at rest is mitigating the risk of unauthorized access. Why use it? The Ponemon Institute had a study in 2012 called the Third Annual Benchmark Study on Patient Privacy and Data Security, sponsored by ID Experts, where they made the estimate that Denis referred to. They said that data breaches are costing organizations, costing the healthcare industry as much as $7 billion annually, that the average cost to a healthcare organization is $2.4 million over 2 years, that 94% of healthcare organizations are experiencing at least one breach in 2 years. And so you start looking at that data, if you believe it, and if, I read it first and I was so skeptical, and I read how they arrived at the figures, and I had to say, okay, it is a reasonable analysis they're doing. One of the factors they do look at is loss of business, that employees lose confidence in your organization and pick a different organization to do business with. And that's where a lot of that cost is coming, not just the cost of directly responding to the incident. But you have to ask yourself the question, and if you're talking to a CFO, right, and about spending some money and some labor on encryption, is it a reasonable thing to do? And I think you'll find in many instances it's costing less to encrypt than not to encrypt, even though there's cost to it. The cause of breaches, that same report from Ponemon, 46% of the breaches were due to lost or stolen computing devices. So that's the number one cause. There's your low-hanging fruit, that if you want to make the biggest, quickest impact, reduce that as a factor to cause you to have to report a breach. And so that led us to this calculation of an annual loss expectancy of 1.2 million, just taking the 2.4 and dividing it by 2, since the Ponemon cited it over a 2-year period. And then that 46% figure we just saw would be the reduction you could get on that 1.2 million by encrypting. Now, that probably needs to be adjusted. The encryption is not perfect. We saw an example of that already, where I talked about that home care incident, an encrypted laptop, but they still had to report it because of the sticky note factor. So 46% reduction is probably not quite the right figure, but adjust it down a tad and you're probably there. And so you can say to a CFO, look him in the eye and say, encryption's, if we can implement encryption for less than $552,000 a year, it's a smart financial move. It makes economic sense to do it. This is a nice infographic from the 5th Annual HIMSS Security Survey, sponsored by Experian. I'm not sure if the next one is out. It should be out any day. If it's not, is it out, Lee? Lee Kim here from HIMSS is saying it is. I didn't get my hands on it, didn't look at it. So we'll see if the data's changed. I just want to point out 2 data points from this infographic. One is it does show the levels of encryption at that time. 65% of organizations who took the survey were saying were encrypting laptops and 38 encrypting mobile devices. We'll look at that in a little more detail in the next slide. But I wanted to point out one other figure. See, the 3% or less of IT budgets are used securing patient data. So what they're looking at there is they're saying what portion of the IT budget is being spent on security, and they're coming up with an average figure of 3%. Well, of course, the averages are pretty misleading. I think is a fair standard deviation on this data, if I remember right. But we'll look at a slide from Gartner in a minute, and it's going to lead us to the conclusion, it leads me to the conclusion that 3% is not enough. If that's where your spend is at, it's not enough. Not enough to get to a mature security program. I guess I should qualify that. So this is just a little more detail out of that same report on the encryption stats, and they break it down between hospitals and physician practices. And so you can see in many cases, of course, the hospitals are doing a little better at encryption than the physician practices, but there's a couple areas where the physician practices do better. Mobile device encryption is pretty low. That definitely needs to get up there, right? If we're allowing email to be read from a mobile device, it's getting cached on there if you have sensitive information in the email. Backup tapes bother me a lot to see half the folks not encrypting backup tapes. Unless, even if your backup tapes aren't going off site, they could still be lost, couldn't they? And then this is what I mentioned, this I love this slide from Gartner. They present it pretty often. If you ever attend one of their events or even their WebExes, you'll often see this if it's something on security. So they've developed this maturity model for security programs. They score it here from 0 to 5. Sometimes they show it from 1 to 5. They have those labels above there: non-existent, initial, developing, defined, managed, optimized. And then I love the little more colorful phrases: blissful ignorance to awareness to corrective to operations excellence. The red line is showing that as you develop a more mature security program, your composite risk position drops. Well, it better, right? If you're investing all that time and money in building out a security program, it better reduce your risk, and indeed it does. Then the black line is showing, I guess, both from left to right and from bottom to top. They're showing just the increasing maturity of the security program, and I like the little milestones that they put on there, just at a very high level, kind of giving us some suggestions on how does a security program mature and develop over time. It starts, they're saying, with reviewing the status quo. So I would say a risk assessment is a great way to review the status quo, to understand in your environment what's going on. That's the whole purpose of it. To establish your security team. So security doesn't happen by magic. It happens by hard work, by skilled people. So if you don't have someone in charge as more than a figurehead, but someone who really knows what they're doing and is leading the charge, and it's not just down in the operational mire either, but is working on strategic initiatives to improve your program, you're not going to make progress. Develop that policy set, initiate a strategic program, and I'll let you read the rest. But I do think those are some key points. They sometimes present this additional data, and so this is looking at their customers, which are typically Global 2000 organizations, and asking them to score themselves. They have a tool that you can score yourself and define your maturity level, and then asking those questions to gather the budget information. So notice they're saying the organizations they find spending less than 3% on security are still back in that stage 0 to 1, that blissful ignorance stage. They're not getting there, and they're not going to get there probably at that level. And that as they move out of that level, as they establish their security team, do their risk assessment, and move into really developing their security program, they have to spend a little more money. Okay, we're going to zero in on encryption. Encryption's been around a long time. The Spartans were doing it, I guess, in AD 500. And some of those early methods of encryption were not much more complicated than rearranging the keys on the keyboard, as I put on this little comic that I found. Played a key role in a lot of wars, World War II, both our success against the Japanese and the Germans involved in various ways breaking their cryptography capabilities. A very simple definition or description of encryption. It's simply taking plain text data and transforming it into ciphertext. Plain text data is readable. Ciphertext is not readable. You use an encryption algorithm to do so. There's a key that's a component of that algorithm. The algorithm itself is public information. There's no secret. You don't want to use a secret encryption program. If you have a vendor that says they're using proprietary encryption, you want to run, because these encryption programs have been well vetted, well investigated for weaknesses, and those are the ones you want to use. It's the key that you got to protect. It's the key that's secret. In order to read the ciphertext, once it's encrypted, you have to decrypt it, so just a reversing type of algorithm. And if it's symmetric encryption, you'll use the same key. If it's asymmetric, you might use a different key to decrypt it. Most encryption and data at rest, or maybe all of it, is symmetric key. The regulations refer to, you have to follow this daisy chain of one to another to finally arrive at this, but these are the levels of encryption you need to be using, or the types of encryption that are supported by FIPS 140-2 today. So AES encryption, and that's what's recommended in the documentation. They still support triple DES with either, here I say 3-key triple DES, but I believe 2-key triple DES is also still supported. There is this thing called FIPS 140-2 validation. So if there's an organization that's developed an encryption product, they can go through FIPS 140-2 validation. My understanding is it's an expensive process, so you see some tools that don't do it, but I also see those who've been through the FIPS validation who say problems were found and that it's a valuable exercise, and so you're going to have more confidence in the tool if it's been validated. It can be validated, I think, at 4 different levels within that process. I just wanted to mention this resource. This comes out of that toolkit that was mentioned in the introduction here by David. This is a paper I helped write in a team of people that were on the risk assessment committee a couple years ago. It talks about addressing, and the title is Addressing Encryption of Data at Rest. I didn't put the rest of the title down. It was pretty long, but you can read it. Yeah, it has a lot of overlap with what I'm presenting today and gets into more detail in some areas and less in others. So is encryption required by HIPAA? Well, it's an addressable implementation specification. Hopefully by now we all know what that means, that if you look at any given possible encryption scenario in your environment, any given situation where there's data at rest and encryption could provide protection, you have to ask the question, is it reasonable and appropriate to encrypt in this situation? And if it is, you must encrypt. That's not it's not an option. Unless you can say it's not reasonable and appropriate, you must do it. And if you decide it's not reasonable and appropriate, then you have to ask the question, well, is there some other controls, some other safeguards I need to implement to provide protection in this situation? And if you decide to go down that path, you have to document why you decided not to encrypt and what those other controls are that are in place. But I think the better approach to take is not to ask the question, what should I do instead of encrypting, but to ask the question, what should I do along with encrypting? That's the security concept of defense in depth, or a layered approach to security. And it's the recognition that no security control is without its weaknesses. None of them are foolproof. And so you don't want to depend on just one or two. We're going to see some examples of people who did. Oh, did I do that? Hey. And this slide really illustrates this point, and I'm sorry to name names, but this is public information that, just as I was preparing this presentation in December, we got this information from healthdatamanagement.com that Horizon Blue Cross and Blue Shield had a breach of 839,000 plus members. And it happened because 2 password-protected but unencrypted laptop computers were stolen. Those laptops were cable-locked to employee workstations. So you read these news releases, and you'd love to ask 1,000 questions about what happened and why it happened, and you don't always get the chance to do that. But I'm thinking they did a risk assessment, and they decided cable locks were, along with some other things I'm sure they don't mention here, locks on doors and maybe closed-circuit TV monitoring and probably other controls in place too, but they came to the conclusion encryption was not reasonable and appropriate. And I'm sure they wish they could do that one over again, because you do the math. Poneman says it costs $200 per record for a breach, so it's a $200 million, nearly a $200 million breach. And then a smaller one at about the same time came across. And this one's just interesting to me because it says it is an encrypted laptop. It does talk about paper files too, so I don't know if those 1,300 people that were notified were just all on the paper files. But I'm more inclined to think that there was something wrong with the encryption that led them not to realize, much like the home care example. Perhaps realize that if you're doing full disk encryption on a hard drive, and if that drive is booted up or that laptop's booted up and running, that data is decrypted then in the memory of the computer. So that would be one scenario where full disk encryption it's failing to provide you the protection you might have thought, and where it can break down. I just have a couple more points I want to make, and then Denis is going to talk about what they did at Central Maine. I wanted to go through here, what are those alternatives to encryption? What might you do if you're trying to evaluate? And again, my recommendation is to say not instead of encryption, but along with encryption. So I listed encryption first, and I start with some technical controls here. Encryption is very effective, but the weaknesses would be that the password that protects the key or the key itself could be compromised, that the data is encrypted when you're logged into the device, and there's other vulnerabilities, some of which might be caught by that FIPS 140-2 validation. Passwords, easily bypassed. You always want to have them, of course, but out of a laptop, you just pull the drive out and mount it some other way, and you've bypassed the operating system. Timeouts, secure wipe, tracking, all of those have their benefits. They can help you deter, help you recover maybe from a breach, but they're not going to prevent it. And then this last one's worth a little discussion. Information flow enforcement, such as virtual desktop infrastructure, is certainly pretty effective sometimes in keeping data off the endpoint. And, if there's one I would focus some attention on, and I think a lot of people are focusing attention on, it may or may not lead you to say, I'm not going to encrypt. It depends on how confident you can be that no data is going to flow to that endpoint. But we could list other things here. This could be as simple as redirecting My Documents to the network, the My Documents folder to the network, or using Outlook Web Access instead of the full Outlook client. And you can disable caching of attachments in Outlook Web Access. There's a number of things you could do along these lines. And then, of course, there's administrative controls, policies, procedures, education, signed acceptable use agreements. They certainly are important. You certainly want these as part of your controls, but so many people have depended on these and gotten burned, right? I bet you we could all just name all the health systems who trained their people, no EPHI on USB drives on laptops, and then one after another, they get a breach. And then physical controls. So here's where we talk about inventory, asset tracking, video surveillance, recording, the cable lock idea that we talked about a minute ago, and then the locked servers, in data centers. I'm curious if anyone wants to say, does anyone encrypt their server hard drives today? Is anyone moving in that direction? A few people are. Okay. And I think we're going to see that movement because hardware level encryption is becoming more ubiquitous. If you can do the encryption at the hardware level, it's not affecting performance. But there's a lot of factors. Most people are not encrypting hard drives in server rooms, as far as I know. And those compensating controls are the key, right? So this is one where you got to document that you've decided not to, this is addressable, you decided it wasn't reasonable and appropriate because you've got all the physical controls in the data center. You're not letting the vendors walk out with any hard drives that they're repairing under warranty. You're using secure transport if you ever have to move a hard drive or a backup tape or whatever. Those kind of controls have to be documented to support your decision. This is my last slide, just to talk for a minute about different types of encryption. I've alluded to whole disk encryption a few times or mentioned it. Denis will talk about that a little more. You usually do end up with pre-boot authentication because the operating system itself is encrypted, so you got to get something to start up the machine and get the operating system decrypted before you can get going. Virtual disk, volume, file, folder encryption. These are a little different approach. One nice thing about file encryption is if you have something really sensitive and you don't even want your IT people, your system admins to be able to get access to it, you can encrypt that file before you save it on the server, and only the people who know the passwords can get in. Of course, make sure there's more than one person that knows the password if it's critical data. Backup tapes, databases, we could list, of course, smartphone encryption, all these different devices. Most of them have their own tools, right, and their own ways to encrypt them, so you've got to investigate each one and see how you're going to do it. Denis.
All right, so now armed with all the information that Jeff has provided us, as well as the fact that he helped us do our initial risk assessment, we got underway with our project. So a little bit about Central Maine Healthcare. We're a 4-hospital system. We have a 250-bed acute care hospital, level 2 trauma center, 2 critical access hospital, as well as a 50-bed acute care hospital, and over 85 practices, family practices and specialty practices that we also support. So about 3,500 devices out there at the outer edge. So with this information, we decided that it was time to, the risk assessment showed that we really needed to encrypt our devices. Not just laptops and PCs, but mobile devices also. So we were looking for a product that could do that. It was an easy sell for our CFO. The one thing that I had done, some along the lines of what Jeff showed you, there are breaches occasionally that you can share with folks. I made it a point to make sure that our executive management knew what was happening out there. So when it came time to talk to them about our security program, it was pretty much an easy sell. So business drivers for us, the harm to patients, the harm to your reputation, having your organization show up in the press with a breach. Nobody really wants to have that. It can have long-lasting effects. Loss of trust, we talked about trust earlier. And then the fines, it can be pretty steep. So considerations for tool selection. These are the considerations that we were looking for. So we wanted a tool that could do AES encryption. We wanted the FIT validation. So we were looking for a tool that had that. And we were also looking for a tool that had recovery options. We had used a tool previous that we fought with. Had lost when a key became corrupted. We had trouble on recovering that device. In some cases, having to re-image the device and loss of the data that was on it. People's presentations and that sort of thing. So it was not a good thing for our folks. Policy management, so we wanted something that could work with our AD infrastructure, something that we could centrally manage. One of the big ones, performance. So we wanted to make sure that it didn't cause performance issues to our users, especially as we looked to encrypt every desktop in the organization. That was a huge factor. The previous tool we had used caused very slow boot ups on laptops and performance degradation that our folks were not happy with. We wanted something that was reliable and had low impact on the field support, something very easy to support, low impact on their time and their ability to get our customers back in service. So these are some of the tools that are available out there. There are some free ones. If you're a Microsoft EA customer, some of the top 2 options are available to you. Microsoft also has the application-based encryption. There are some free ones, TrueCrypt and 7Crypt or 7-Zip. The commercial tools are the ones that we were looking at. We were still an XP shop out on our desktops. So we were looking for something that could get us to the point where where we got Windows 7 out on our desktops, and that was a couple-year project for us to upgrade and migrate 3,500 stations to Windows 7. So we needed something in the interim that would put us in a safe position. So pros and cons matrix, pretty essential in looking at the various solutions. So this is one example of the pros and cons matrix that we put together. We actually looked at 3 products, but to get everything on one slide, we knocked one column out. Pretty much the same kind of information. But like Jeff said, there are options, whole disk encryption versus file-based or folder-based encryption. Encrypting a whole disk typically requires that you have boot up password. We were looking for an option that didn't have that. We have shared workstations throughout the organization, and we wanted a device or a program that would allow us to have multi-use PCs out at the user level. Removable media. So we were also looking for an application that would assist us with encrypting flash drives, DVDs, and CDs. The product that we were using had no capability, previously using had no capability of doing that. Again, we wanted a centrally managed application, so we wanted something that we could manage through AD policies. Again, easy for the support staff to support. We wanted a tool that didn't essentially mess with the Microsoft Gina. Microsoft Gina, as you may know, is the control, delete, the login window that you use. And some apps like to put themselves in front of that, and when you do have an issue, your users can't log in. So we wanted to make sure that the tool we had selected didn't cause that kind of issue. And we wanted a tool that had Microsoft installer packages that we didn't have to build ourselves. So we were looking for a tool that had that level of sophistication. And again, performance impact. So we were looking for a tool that didn't cripple our workstations. So we did find a tool. There are tools out there that work that way. We ended up selecting a folder-based tool. It was important for us that we could set a default level of encryption of various folders on our desktops. We use Citrix in our environments. We're able to use that as one of the defense layers in defense, I should say. We use, I'll speak to that for a minute. Jeff mentioned layers of defense in depth. So we don't only use encryption, but we use timeouts and passwords. Citrix is part of our defense, so we make sure that as many apps as possible are running on Citrix. The other thing we do is that we do MyDocs redirection. So less information is stored on the desktop. So MyDocs on the PC is redirected to a folder on a shared server. So we were looking for a tool that had superior management capabilities, something that could be managed through policies, again through AD, and that could do devices such as flash drives, DVDs, and CDs, and price was important. We did find a tool, and I'll get more into that. So our project, just want to make sure. I didn't skip a slide here. Yes, I did skip a slide. So we found a tool that fit our needs, and then as we proceeded, we wanted to get that rolled out. So we created a project team. The project team that we put together, the steering team, committee team, not only oversaw this project, but our security program in general. So not just encryption, but the other components of the security program. So we formed a steering committee that helped us evaluate the products, evaluate the user impact, and select a few vendors to start with. So we gathered our requirements, determined our budget, working with our CFO, and it ended up being much less than the Poneman Institute number. So it can be done for less than what you might end up paying for a breach, a lot less. We researched our vendors. We wanted to make sure that we talked with other folks in the industry. What were they experiencing? What worked well for them? Folks that had a similar infrastructure to us. So we talked with folks that were doing pretty much the same kind of thing, and what had worked well for them, what didn't work well. So that's an important part of the process. We down selected to a few vendors and then brought them in for demos and proof of concepts. my guys on the team didn't think we could do it, but even working with some of the larger vendors, you can negotiate your contract, and we did negotiate our contract. Our contract was negotiated in that if we didn't have a successful deployment, we weren't sending them any money until the issues got resolved. So we had a proof of concept that went very well with a few vendors, and then we selected a final product out of that. We developed our implementation plan, which included a pilot within IT first and then rolled out from there. Our rollout strategy included end-user communications, which we thought was very important. Some of the users were starting, especially the more technical users out there, were starting to stress a little bit about the fact that we might be pushing encryption out to their desktops and causing issues. So we did a pretty good communication plan out to those folks, made sure they understood the impact, how quickly would we react to problems if there were problems, and it actually went pretty well. So again, we started with a small group in IT, did that for a few weeks, worked on the issues, resolved them, moved on to a larger group, and then within 6 to 8 weeks, we had encryption rolled out to 3,500 desktops. We had a few post-go-live issues. I'll move right on to the next one. So some of the issues that we had were USB drives taken out of the hospital. Occasionally, somebody will come into the hospital to work on a Word document that really doesn't have any PHI on it, something personal. We have a lot of folks working on presentations for their classes and courses, and they'll encrypt a thumb drive and then have issues with it on the outside. Typically, the issues are because they're low on disk space on the flash drive. They can bring those back in. We'll evaluate them and unencrypt them. We can do that in a matter of minutes once we take a look at it. The pilot, during the pilot, proof of concept, CDs and DVDs were being encrypted as part of the proof of concept. Before we deployed, the vendor released an update, which broke that. We ended up staying with the vendor and did pay them within the 30 days because they also had a product that allowed us to educate a few users that were doing a lot of DVD creations, like our HIM department. There was a local install of a product that we could install, so they were still encrypting DVDs going out of the organization. The resolution to that was getting Windows 2007 out there, which remedied that issue. So we expedited the rollout of that, and we're now encrypting CDs and DVDs. With folder-based or file-based encryption, when occasionally you'll have a virus attack, we found that sending the file out to our virus vendor, they couldn't look at it. They couldn't even open it up because it was encrypted as we copied it off. So we had to unencrypt that before we sent files out. We found during the rollout that certain devices that were connected up to clinical equipment, camera's not probably a good example, but some of the gear that folks use out at the edge, we had to unencrypt. Jeff mentioned that you have to reasonably address a security issue. In this case, we had layers of defense there. The device was not going anywhere. The device was attached to a piece of clinical equipment behind locked doors, so we felt it was reasonable to unencrypt that to get the piece of equipment back in running order. Within a matter of weeks, we found that all issues were resolved pretty quickly, and we, to our surprise, had no ongoing performance issues. It went very well. Most of the time, our users don't even know they have encryption on their laptops or desktops because it's just running behind the scenes and doing its thing without user impact. So lessons learned for us. The biggest challenge, and for us, was really just testing the various products, and making sure that we had thoroughly tested them and selected a product that worked for us. And that, when I say the biggest challenge, that was pretty easy for us. It was easy to fit into our workload, and over a matter of weeks, we had a product tested and selected. So do your homework, put together a pros and cons matrix. It helped us really nail down what we wanted in the product, and it allowed us to compare the products against each other. Again, talk with folks that are having that have experience, similar environments that you might have, and negotiate a proof of concept. We did with a pretty big vendor, and my folks couldn't believe that we actually did it. But typically, vendors will say, no, this is the only option, and we're not going to negotiate. But in this case, our vendor did. So we tested, made sure everything worked well before we rolled it out, and then as we rolled it out, we fixed issues to make sure that the next group of users weren't experiencing the same issues. So why many hospitals? We still think that there's about 35-40% of hospitals that still need to encrypt. We kind of wonder why. Is it fear that they'll cripple their desktops? We did not find that to be the case with the product that we selected, so there are products that will work for you out there. The product that we selected allows the multi-user workstation piece, which was important to us. We have lots of shared workstations out on our clinical floors. And then the hope that administrative and physical controls might be enough. Jeff mentioned the cable locks. I don't know if anybody in the room has ever tried to defeat one of those, but they're pretty simple. It just takes a quick little jerk, and the plastic on the case breaks away, and the laptop disappears on you. The cost. We implemented encryption for our enterprise at a pretty reasonable cost. And I guess the question I would ask here is, can you afford not to do it? We decided that we could not afford to not do it. So, and our experience has been that it's pretty been a quiet installation and quiet from issues perspective, especially compared to the prior product that we had tested or used. So again, final view of this slide. The potential cost of not encrypting and having lost devices. Since we've encrypted, we have lost a couple devices. Doesn't mean that we don't still hunt those down and jump right on it and try to make sure that we get those devices back. But we can rest assured that we have encryption on them as an additional layer of protection. We do timeouts, passwords, Citrix again, so multiple layers of defense on them. That concludes our presentation. Any questions?
So if you have questions, please come up to the microphone in the center aisle, and Denis and Jeff will answer. Questions? Any questions?
Must have done too good a job explaining it.
I guess you guys did a great job. Well, I want to thank Denis
All right.
and Jeff.
Thank you, everyone.
Are you willing to say what vendors you looked at, what your finalists were, and what you selected?
We're not supposed to talk about vendors, but we chose Dell's Credent software.
If you want a clarification of that, you can come up. I think the policy, as it's been explained to me, is not to mention the vendors.
I had a question.
You can.
Excuse me? I had a question.
Sure.
So it seems like the flash drives you're able to take home and that sort of thing, and I guess you can bring them back. Any issues with keystroke loggers or anything like that, or rootkits that potentially could be hidden and would look at your systems and be able to capture passwords and so on?
Well, sure, we've had some issues with that. Mainly around, you've got to have a good antivirus defense, and staying on top of that is essential. So back to the layers of defense, you really have to have a good multi-layered approach. So having a really good antivirus defense in your organization. We use multiple products. We have antivirus as well as anti-malware on our desktops to make sure that we're protected against that kind of stuff.
Yeah, there's some pretty sophisticated software programs out there they hide themselves.
Yep.
And
Yep.
so typically antivirus is only going to be able to look for what it's designed to look for.
Exactly. So you have to stay on top of it, and that's why we use the anti-malware product also on top of that to look for, and we do periodic scans, nightly scans against the workstations to make sure that we're capturing and looking for that stuff. And it is a challenge to keep up with. Those guys are working hard and fast to defeat the tools that are available out there, so you do have to stay on top of it. Any other questions?
Hi. Not sure you can hear. Can you talk a little bit about, for the population that you weren't able to encrypt and perhaps switching into the server rooms, what your defective media policy is and what you worked out with your vendors? And then second question, probably for Jeff, you spoke briefly on secure transport, and if you could kind of give me an outline of what your expectations are for that.
Okay. Okay, so the first part of the question, so media retiring process, I'll call it. So the software that we chose allows us to keep track and inventory of the flash drives and media drives that have been encrypted. So we educate our users in an ongoing fashion to make sure that they know that when that device is going to be rendered useless or retired, that we want to have that device destroyed. So we communicate with our users to make sure that they know that they're responsible for returning that device back to us and making sure that it gets destroyed. Jeff, for the second part?
Yeah, just a few thoughts on secure transport. Different scenarios. You might be transporting backup tapes off-site. You might be transporting tapes for disaster recovery events or tests. Certainly, there's often transporting that occurs when you're destroying media, if you're giving it to a third-party vendor to do so. In all of those cases, you want to have locked containers. You want to have tight handoffs with inventory of what got handed off. Like if you're handing it to a company that's going to destroy the media, I've seen companies just say, here's a box of hard drives, let us know what we gave you and go destroy them. And you want to know what you gave them, because you want to know that what they tell you they destroyed matches up with what you gave them. So you just want to have tight handoffs. Those are the things that come to my mind, as well as locked containers.
What about like mobile devices, like phones and tablets?
As far as destruction, wiping?
Oh, I'm sorry. As far as encrypting them.
Oh, as far as encrypting them? Well, so the Apple, if you just turn on the password, you've encrypted at a hardware level. You've encrypted the media, the storage. That's true on the iPhone and the iPad. I think Droids are a little more complicated, and I don't have the details on how you encrypt those. But there's ways to encrypt Android as well. It is definitely device specific. And then, on the destruction, you really have to take a look at what the manufacturer says about proper disposal. It's usually some kind of secure wipe of the media.
So, and I'll add to that. We standardized, I can't believe I'm saying this because I'm an old PC guy, but we standardized on the iPhone and iPad devices because of their hardware-based encryption. So we don't allow Droid devices because of the lack of proper encryption on those. But we also put another layer of protection on those devices, and we put an MDM software, mobile device management software, on those so that we can essentially hunt them down if they're lost, have them wiped, and make sure that they're safe. We also, use Citrix to make sure that there is very little going on those devices, but in the event something does get on a device, we can wipe it.
You said that you had to go to Windows 7 to do because of encryption for your CDs and DVDs. Did you give any thought to the self-encrypting DVDs that are available instead of going down that route? I mean, I know XP is at end of life, but did you, at the time you were doing this, it wasn't quite where it is today? Yeah, actually, we had looked at the self-encrypting flash drives as well as the CDs and DVDs. They're expensive. We knew we needed to move in the Windows 7 direction anyways. And we did have an interim solution that we felt protected us pretty well. We had a limited number of departments really sending out CDs and DVDs, so we made sure that they had that on-the-go software essentially installed to their PCs and made sure that they were sending out things encrypted before they sent them out. Pretty easy for them to use, similar to using WinZip or PKZip tool for them, so it was pretty simple. And as you mentioned, we were also watching the Microsoft date for elimination of support for XP. So we knew we had to move in that direction anyway.
So if you have more questions, please see Denis and Jeff one-on-one. And let's thank them again for a great presentation.
Thank you.